It starts with the tongue posture and ends with medical gaslighting of your own body. In the last decade, a growing number of videos, forums, and influencers have been promoting a controversial set of techniques, promising to reshape the jawline, align teeth, and improve overall facial appearance. These techniques are collectively known as Mewing and Orthotropics. But what does the science actually say? Are these methods a breakthrough in facial development or just simply another internet-fueled trend? This comprehensive video, a 5-part series, is going to take a look at critical evidence-based claims that are surrounding this technique. We'll examine their origins, their basis, social impact, and most importantly, the clinical evidence behind them. So let's begin. What is mewing technique? Mewing is a posture technique that involves pressing the tongue against the roof of the mouth, specifically the hard palate, while keeping the mouth closed, teeth lightly touching, and nasal breathing emphasized. The central claim of mewing is that proper tongue posture can improve the jawline, enhance cheekbones, straighten teeth naturally, prevent or even reverse orthodontic issues like malocclusion. Orthotropics is a term coined by Dr. John Mew in 1970s. He called it a set of growth guidance techniques aimed at children and adolescents. Orthotropics seeks to reshape the face by correcting tongue posture and promoting forward facial growth. Its core principles include maintaining a closed mouth with tongue on the roof, nasal breathing, correct head and neck posture, using appliances or exercises to train proper posture. Supporters claim that orthotropics can prevent crooked teeth before they occur, enhance overall facial harmony, and improve breathing and even behavioral development. There has been legal and regulatory backlash against Dr. John Mew. In 2017, Dr. John Mew, the founder of Orthotropics, lost his license to practice orthodontics due to lack of adherence to evidence-based protocols, use of unregistered devices, and promotion of unverified therapies. His son, Dr. Mike Mew, continues to promote orthotropics internationally, often citing anecdotal outcomes, facial symmetry ratings, which are not medically recognized metrics. The technique exploded in popularity around 2018 as YouTube channels and TikTokers began showcasing before and after photos, promoting this practice as a natural alternative to surgery or braces. However, orthotropics has been controversial from its inception due to a lack of controlled studies, and it has been rejected by mainstream orthodontic communities. So why are these methods so popular? How many times the word mewing was mentioned in 2024? From just a mere mentions of 1,000 words, it's exploded to 20,000 mentions just on social media. There are several reasons. Number one, aesthetic obsession. In a culture where we're increasingly obsessed with jawline, symmetry, and masculine features, mewing is a shortcut to Instagram-worthy looks. Number two, non-invasive appeal. Mewing and orthotropics has promises non-surgical results, appealing to people who fear braces, extractions, or surgery. Number three, these methods are promoting a DIY approach. No orthodontist? No problem. Just adjust your tongue posture. And there's the virality of social media. The technique's visual promise of before and after transformation made it perfect for short-term content platforms like TikTok and YouTube. So why is scientific scrutiny important? When any health claim is made, especially one involving bodily modification, we must assess its principles using evidence-based medicine. That means looking at peer-reviewed clinical trials, meta-analysis, longitudinal cohort studies, biological plausibility, professional consensus. Because while anecdotal evidence and testimonials might sound convincing, they do not substitute for scientific rigor. How do we critically appraise scientific evidence? In evidence-based medicine, the reliability of a claim depends not just on whether it was studied, but how it was studied. We assess studies based on hierarchy of evidence. For example, randomized controlled trials are better than cohort studies, are better than case studies. So how does the face grow? To understand whether techniques like mewing can truly reshape your face, we must explore the science of craniofacial growth. Facial bones develop through a combination of genetic programming, mechanical forces, and functional adaptation over time. Key structures are going to include your maxilla, the upper jaw and mid-face, your mandible, the lower jaw, zygomatic bones or cheekbones, and the temporomandibular joint, the TMJ, where the jaw hinges. Tongue plays a mechanical role in shaping the palate during early development. A high tongue posture can exert gentle upward and lateral pressure on the maxilla. This pressure can then influence the width of the dental arch, especially in infants and pre-adolescent children whose bones are still malleable. However, once skeletal maturity is reached for transverse growth of the maxilla, which is typically around 7 years of age, bones are far less responsive to just simple tongue exercises. The legendary Dr. Prophet in his contemporary Orthodontics notes that muscle pressure is only effective when sustained over long periods and combined with growth. Just brief low pressure contact from tongue exercises is going to be insufficient to grow bones. So what is mewing claiming? Well, that constant tongue posture can move maxilla upward and forward. That this movement improves the jawline, mid-face projection, and even breathing capacity. What does the science show? Well, sustained orthopedic forces that come from things like braces, twin blocks, headgears, Herbst appliance, they can move teeth, they can move bones in children. Tongue posture alone does not produce enough sustained force to move bones significantly. But again, the key limitation is force, intensity, and duration. Braces and orthodontic appliances apply 100 to 500 grams of force consistently, while tongue posture averages just 10 to 20 grams, often inconsistently applied. Part 3. Evidence review and study appraisals. This is an opinion paper by Lee in the Journal of Oral and Maxillofacial Surgery. It reflects expert consensus and echoes warning from governing bodies like the American Association of Orthodontists. In 2022, we had the Tavusi University of Alberta thesis. It had a sample size of about 100. They compared it to cohort. There was no randomized control group here. It was retrospective, and it basically looked at cephalometric measurements. So what did they find? No statistical significant skeletal or dental changes. They found some minor soft tissue changes, potentially due to growth rather than the treatment. There was a high risk of selection and compliance bias in this study. There was low external validity, and it's useful as a hypothesis generating study. Overall score, I'm going to give it a low. This study did 2 phase treatments where at phase 1, they had the kids wearing these removable plates, and then they gave them a series of structured exercises to do with tongue, posture, oral muscles, talking, speech. And in phase 2, after phase 1 was completed and they had some expansion of the dental arches, they then gave these patients this BioBlock. In my opinion, they're horrendous looking things, and I feel sorry for kids who wear them, but they're actually really, really big, bulky pieces of acrylic. Sorry, crap. I'm not a big fan of acrylic as an orthodontist. I'm a fan of anything that is fixed in the mouth, anything that works. I don't mind aligners though, but I do not like acrylic plates. You know why? 50% compliance. You do not get compliance from kids when you give them such big, bulky plates. I mean, look at this poor kid. Can he even talk or wear it and be comfortable? So this study, overall grade score, low. In fairness, John Mew did present in 2007 some facial changes in twins that were treated differently, one with mewing technique, one not. There was no randomization. It was a subjective aesthetic evaluation. The twins had confounding lifestyle variables that were uncontrolled. Lay judges perceived one twin as more attractive after orthotropics, and a highly subjective and non-quantitative outcome. What is the evidence-based medicine verdict here? Well, this study had a very high risk of bias, anecdotal value only, very low grade score from me. Can mewing technique affect the airway? Some proponents argue that mewing can open the airway and improve breathing or sleep apnea. While airway size can correlate with jaw position, no randomized controlled trial exists proving that mewing posture alone increases airway volume. A 2020 review in sleep medicine clinics did conclude that oral myofunctional therapy may help tongue positioning in obstructive sleep apnea patients. However, these were very structured, clinician-guided programs, not DIY tongue exercises. The key insights they found was that structured myofunctional therapy does improve some OSA parameters, like AHI, and that DI methods are not evaluated here. What does this study have relevance to mewing? Well, it shows that posture-based therapy may help breathing when guided professionally. I give it a score moderate. What do professional bodies say? Well, both the American Association of Orthodontists and British Orthodontic Society have issued strong statements warning against unsupervised or non-clinical facial development interventions. The key AAO statement in 2020 was, attempting to move your teeth or jaw without the supervision of a trained orthodontist may cause permanent damage, including misalignment, temporomandibular joint dysfunction, and more complicated future intervention. As trend grew, so did skepticism. Kevin O'Brien's orthodontic blog began reviewing claims from a scientific lens. Viral trends like mewing may undermine trust in evidence-based care. They delay proper diagnosis or treatment, and they introduce structural or dental complications. So here are the potential physical risks of mewing and orthotropics. Number 1, tooth misalignment. Placing pressure against upper palate incorrectly or inconsistently may shift teeth subtly over time, especially if an individual also clenches or applies uneven forces. In adolescents with partially erupted dentition, this can lead to open bites or even dental crowding. Number 2, temporal mandibular joint stress. In some cases, individuals trying to force their jaw into a forward position will experience clicking, locking, grinding, muscle pain, maybe even headaches. Prolonged strain on the TMJ without clinical assessment can result in chronic joint dysfunction. Number 3, delayed professional intervention. Arguably, the most serious risk is the delayed use of proven orthodontic treatments. Some patients report spending months or years practicing orthotropics or mewing before finally seeking help, often with a worse malocclusion, bite asymmetries, and possibly still breathing issues unresolved. So what happens if oral posture is incorrect? Well, poor oral habits can indeed impact development in young children. Things like thumb sucking, low resting tongue posture has been linked to narrow palates, open bites, mandibular retrusion. This is where orthotropics makes a valid theoretical point. Early habits matter. But now extrapolating these into claims that adults or even adolescents can remodel their face using posture alone lacks supporting data. In summary, internet made it, science challenged it. Mewing's rise is a case study in the power of aesthetic narratives, the speed of misinformation online, and the need for early scientific communication. Without robust counter-narratives, pseudoscience can take hold, especially when it's packaged in aspirational visuals. Here's the bottom line. Number 1, there is no strong evidence that mewing changes adult facial structure. The biomechanical forces generated by tongue posture are simply too weak in post-pubertal individuals. Claims of lifting the mid-face, reshaping the jaw, or widening the palate, they lack empirical support. Number 2, Orthotropics has some theoretical grounding but lacks clinical proof. In children, posture and breathing habits can influence orofacial growth. That said, Orthotropics lacks randomized controlled trials, regulatory approval, standardized protocols. Its main proponents are case reports, anecdotal evidence, and photo comparisons, which are not accepted scientifically. Orthodontic, orthopedic, and surgical interventions remain the gold standard for treating jaws, teeth, and bite. If you're an adult, adolescent, or parent of a child with some concerns about the structure of the jaws, asymmetry, or malocclusion, the best course of action is a consultation with an orthodontist or a oromaxillofacial specialist. And to end with my final thoughts, let's talk truth over trends. Mewing is a perfect example of how aesthetics, science, and social media can collide. It plays into the fantasy that with enough self-discipline, you can mold your face like clay. But biology doesn't work that way, and neither does bone. You deserve facts, not filters. If you're watching this because you feel insecure about your face, you're dealing with a bad bite, or you're seeking improvement, please consider talking to a licensed orthodontist, getting a full facial growth assessment, using science, not shortcuts. Because in the end, the best transformation is one based on truth, care, and health, not algorithmic illusions. Thank you for watching. I hope you enjoyed this video. I'll be leaving links down below of many of the studies and credits and resources that I've shared today